Dr. Jo Trepka is the chair of the Epidemiology Department at Florida International University, and she's joining us live now. Dr. Trepka, thanks for being with us. What's your reaction to what the governor of Alabama, we just had her on our air, which she's saying that it's time to start blaming unvaccinated people for this latest surge?
Well, we have 3 highly effective and safe vaccines. We have the tools to control this pandemic. We just need to use them. So I would say that people need to get vaccinated now, especially with the Delta variant, especially with what we've seen in this sharp increase in cases that we've seen here in South Florida. We have 5 times as many cases as we did in early June, and in Florida, where we have 6 times as many cases as we've had in early June.
Doctor, we're hearing about young people, some of them teenagers, hospitalized with this new variant. How do parents protect their children?
The Pfizer vaccine is authorized for children 12 years of age and older. So I highly encourage parents to get their teens vaccinated. My 2 daughters were vaccinated with the Pfizer vaccine. They're teenagers and they did just fine with it. And I'm so relieved that they had the opportunity to be vaccinated. For parents whose children are under the age of 12, it's more difficult. And what I would say is do the best you can to protect your children until the vaccine is available for children under the ages of 12. That means be very careful in terms of having them wear masks at all times when they're in public settings. And I would avoid crowded areas because there is so much SARS-CoV-2 in the community right now.
Dr. Trepka, the numbers we're hearing are simply staggering. What are your thoughts on the state of the pandemic in South Florida right now?
Well, as I mentioned, we've had a sharp increase in terms of the numbers of cases and also the percentage of people testing positive. We've seen an increase in hospitalizations. We may end up seeing many more deaths as well. So although it's not as bad yet as it was last summer, we're certainly in a very bad situation. And again, I think it's because we don't have high enough vaccination rates, particularly people under the age of 65, and particularly people who are in their 20s and in their 30s. So we need to improve our vaccination rates. The Delta variant, of course, is making it more difficult as well. The problem with the Delta variant is it's so much more contagious. And finally, I think that people were feeling like the pandemic was behind us. Things were opened up. You didn't have to wear a mask, and we got rid of a lot of our physical distancing requirements. But unfortunately, the virus never went away, and in fact, it's now resurging. And so we really have to clamp down again. And I think that means both not just vaccination, but also that people should be wearing masks when they're in public places and indoors, and especially in crowded places.
What would be your advice to local school districts come fall, whether or not children should be required to wear masks or whether it should be optional? What's your advice? If children are not vaccinated, it's essential that they wear masks. It is a highly effective tool. Vaccines are our best tool, but if they're too young to be vaccinated, they need to be wearing masks. They run the risk themselves of becoming infected and potentially having problems, and they also run the risk of infecting people in their family and the people around them. So for that reason, for their benefit and the benefit of the general community, they need to be wearing masks.
Dr. Trepka, I've heard from some people who say, well, I already have COVID, or I had it, so I have the antibodies, I'm protected, I don't need the vaccine. Is that in fact true, or is there sort of a shelf life on that antibody protection from having been exposed to COVID in the past?
That's right, the latter. So if you already had COVID-19, you should still get vaccinated. The immunity that you get from the vaccine is much more long-lasting, seems to be better against the variants. So we highly recommend that people get vaccinated, even if you have had COVID-19. There are many people that have had more than one case of COVID-19, so you can get infected again.
I have one more question, because I've spoken to some young women who say they're not vaccinated because they're worried that it could somehow affect their ability to bear children later on. They say they're young, they want to have a family, and they're not certain about that. Is that a fact that we're not certain, or are the scientists pretty much in agreement on this?
I think the scientists are very much in agreement that there is no risk to fertility with the COVID-19 vaccines. There really is no basis for that myth that has been circulated. It's very unfortunate that has circulated because it does scare people, but we just don't have any evidence for that. We have now vaccinated like 180 million people in this country, and the incidence of severe adverse events is extremely rare, and extremely rare in particular when you consider how common COVID is and how common adverse effects occur after the COVID-19 infection. So prior to this time period when we have these very high rates, the benefit to getting vaccinated was much greater than the risk. And now with these very high rates of COVID-19 in the community, the benefit is even better for getting the vaccine than the risk. So it's much the benefit to risk ratio is just extremely high now for getting the COVID-19 vaccine.
Okay, seems pretty clear. What you're saying seems very clear to me. I hope people are listening and paying attention. Dr. Mary Jo Trepka from Florida International University, thank you very much for joining us this evening.
Thank you.
Thank you.